Okay, he's first tonight. Okay, let's give her a minute.
Dr. Who?
Donna, can you hear me all right?
I can hear you.
Okay.
Can't see you.
Well, that's probably best for everyone.
We can't see it. We can't see it.
No, we get to look at you guys. It's true.
Oh. The same as the other. Yes, that's true. I just didn't know what there.
Okay. I really thought about it too.
Sky is so patient. Lisa, this is okay.
Very confident.
That would be good. That,
Oh, dear Steve.
Hey, Drew. Hey, Lisa. You have no vest on today.
Wednesdays are tight days because my day runs way later, so I run home to do the Zoom meeting and then I go and coach soccer. So,
Oh, okay.
So Lisa, you just dialed in. This is Erin. Jason and I are here in the room with city staff, and then you can see who's on Zoom. We're just waiting for Alina to call in because she's basically facilitating our discussion today. So we'll just give her a couple minutes.
yeah, she's just.
thanks, Ben.
You want to mention?
So folks, while we have you and we're waiting for Alina, just a heads up that we booked this room for our next, for this meeting as well as our next meeting in 2 weeks. So if you're local and you're comfortable coming downtown, we have all sorts of space and fresh coffee. So you're more than welcome to join us in person next meeting.
Just sent it.
Should turn it in.
I just sent it these instructions.
There she is.
Great. Hi, Alina.
Hi.
Hi, it's Erin. I'm gonna be chairing today because Dawn's been under the weather.
Oh, you're in the same boat as me, John. I'm gonna be raspy too. That's all right.
Okay, I'm gonna start us off. So, good afternoon and welcome to the October 14th Health and Housing Task Force meeting. I'd like to recognize that we're on the traditional territory of the Nanaimo First Nation. Today's special meeting of the Health and Housing Task Force will be held in accordance with the Community Charter, Council Procedure Bylaw 2018, number 7272, and Ministerial Order number M192, governing open meetings during a state of emergency, and the Provincial Health Officer Order regarding mass gathering events. Therefore, members of the public are required to observe meetings virtually and not attend in person, and question period will be suspended throughout the duration of the provincial health orders, while the duration of the provincial health orders are in effect. And then I have some extra, if anyone is on the telephone, would you please state your name? I think we see everybody. We're good? Okay. So, Alina, my understanding, we have some minutes to adopt and we'll get there, but my understanding is that you're gonna hold the reins for us today during the meeting? Is that your understanding?
Sorry, repeat that, Erin, you just cut out for a second.
Sure. So my understanding is that you're going to walk us through with your slides. You're going to be kind of leading us through this. Is that accurate?
Yeah.
Okay, great. So before we dive into that, then we just have some minutes to adopt. If I can have those moved, if everyone's reviewed them. Dawn?
Hi,
Oh,
Erin,
Motion
Murphy
moved.
wants to let you know I'm on the call.
thank you, Lisa. Okay, a seconder for adoption of the minutes? John McCormick?
Peggy seconds.
Thank you. Are we all in agreement? Anyone not like the contents of the minutes? We're good? Okay, thank you. I'm nailing this. Okay, Alina, over to you. You've got some slides for us.
Yeah,
And
that's
just governance options.
awesome. So before I start, I don't know if Lisa or Karen, did you guys want to just preface this component, or just because of the pivot that you were asking me to do today? Sounds mysterious, but it's really not.
Okay, so you've got the slides that Lina's given, and what we've asked you to do is give us a quick recap of the project deliverables, and just remind us what we're trying to do here, and then also look at some of the initial findings that Alina has come up with in terms of how we move forward. So that includes going back to the slide, Alina, where you showed the different scenarios and the outcomes and demand for resources based on how well we coordinate the system. And so just a bit of a shift that way, and an opportunity to work with Alina through what we're trying to do here. And that's really to set the stage for us as we start looking at the different governance options and funding, but reminding us of where we're at, why we're doing what we're doing, and how close we are to meeting some of the project deliverables. So with that, Alina, I'll let you away.
Did you also want to mention anything about the invitation around the governance workshop?
Yes, that's right. So some of you are aware that there's a Health and Housing Task Force Working Group, which is a smaller group of you who volunteered to help steer the work with Alina. And last Wednesday, we discussed the need for particularly with the funding, that there are several organizations and individuals who haven't been part of the process who are key to supporting the work of the Health and Housing Task Force. And we had talked about last Wednesday trying to get those names together and inviting them even to this meeting. In hindsight, was A, too fast, and B, didn't give yourselves as the whole task force a chance to have that discussion in full about who else needs to be part of the conversation. So for some of you, it might be other people within the organization. It might be people that we invited to the design labs. It might be other organizations that we haven't considered yet. So that's another part of the conversation that we thought would be important to have to bring us up to the next meeting that we know will be with us.
So just to recap, then at our last meeting, we had said the October meetings of the task force would essentially be canceled, and then we would be shifting into those two governance design labs. But because folks felt like we wouldn't be ready today, that's, again, I'm not sure, again, Lisa, if you want me to go through slides that I had prepared for the governance discussion today, because that's not happening until next time now. So is that?
Alina wants to go through the others. I think it would be helpful to frame it up so people know what to expect and what again, a reminder of what their homework is with their own organizations and stakeholders. So I think that it would be good to go through some of them to prepare people for the conversation and to warm up others who we want to invite.
Okay, so I won't spend as much time as I would have if folks were new to this process, because all of you that I see here have been part of this the whole time, so it would probably be too repetitive. But I'm happy to do some of these components that Lisa mentioned. So what you're seeing in front of you is essentially what I was planning to present, where if this was the governance design lab, because that's what we had initially prepared for today. So everything is really laying up and summarizing what we've done to date, laying out the options for the system plan organization, the different options, and then presenting the homework and next steps. And then this would have been followed up by a second lab where people would bring together the insights they gathered from their own organizations, and then we could have a frank discussion about which option we would recommend to go forward. So some of these pieces, again, you guys have seen them a billion times, where we are and where we're going. You know that the research began in December. We're now looking at just about a whole year. And again, we were initially hoping for July, and now it's probably going to take us into November with the election and some of the COVID bits and pieces. This is not in your package, and I'm happy to share it again, simply because the pivot that staff asked me to do, and so they happen afterwards. But this is what's in my contract with all of you, and my deliverables in terms of me supporting you. And by me, it's not just me; there's other folks on my team that are helping me as well. So you remember some of the work that we did and the needs assessment and that document that everyone has reviewed, the engagement that we did in March and are finishing up right now, the actual plan, so the housing action plan, including the financial modeling as well. So we talked about that in May, but staff has asked me to review that again with you guys today, so I'm happy to touch on that as well. And then the recommendations report would be happening. Obviously, when we hammer all this out, you've seen some of the emerging recommendations that are being vetted in community. The funding strategy, so the financial modeling is obviously part of that, but so was that social impact audit, so that we understood where all the money was coming from. And that would be touched on again when we have the governance conversation as well. Integrated coordinated access, so you'll recall the model that we talked about and the various levels of service navigators, our ability to connect the dots between a situation table as well as some of the reaching home components of coordinated access. So that model is written up and is part of that action plan as well. And then the complex needs integrated service model. So you'll also recall the conversations we've had around complex needs capability, and then how we're going to move forward with prioritizing folks that have been failed by the system many times over. So there's a couple of updates there to summarize, which is that the model is going to be resourced by a staff, or not necessarily a staff, but by an organization that's, there's currently an RFP to seek. And so that's going to be a key part of actually implementing this. It's one thing to develop a model, it's another one to actually make it live. The complex needs component of that is obviously very much entwined, and the situation table ramp up, that's another amazing opportunity to connect the dots between all these pieces. At the last working group meeting, there was an action item that emerged for me to support some of the key organizations that are involved in coordinated access type activities to ensure that everybody was on the same page and comfortable with what is being proposed and how everything related to each other. So those pieces are moving along as well, and I'll continue to kind of keep my fingers in moving that forward alongside many of you that are involved as well. So that's a bit of an update of the key bits that are on my to-do with you all. The whole point of it was to, again, understand what was happening, understand the priorities, come up with our action plan, and then start to move towards some of these implementation bits around coordination, as well as the integration of funding and again, the coming together of this governance component, which is really the big crux right now, and the last hurdle, if you will, before before we can wrap up the action plan. So maybe I'll pause here. Lisa, was there anything else that you wanted me to touch on in terms of my priorities and work plan for you guys? Okay, no. No? Okay. Okay, so you'll, oh, sorry. Sure.
Do you still have any outstanding data requests?
Well, there's always more data that you can get. From my understanding, that what we are able to get, we have gotten. So we've gotten the BC Housing and DHA requests were met. That's why I actually had removed them from the to-do list from our last update on this chart. So those were included in the updated version of the needs assessment as well. Yeah, like sometimes we have all these wish lists of things we're going to get, but sometimes it just doesn't exist in the community. So for instance, a by names list is something that's really useful when you're doing your modeling for example, but if the community hasn't gone through this process, then it's tough for us to generate one when the community is just starting to ramp up those efforts. However, I think you and I have gone back and forth a couple of times on some of the draft by names list framework that were circulated as well. So there's ways that we can kickstart the process where there is no data to get those gaps filled. But yeah, for sure, there's always more we could get. There's always deeper in the financials we can go, but we have to work with what's available for sure.
Erin, I'm just going to ask, because I can't see people on the screen, if people have questions or comments, please just jump in, okay?
Yeah, for sure. So again, some of these bits, it's going to be a bit of a recap for all of you because you've seen them before, and I keep saying that, but it really, this was designed for folks that weren't familiar with this. You'll recall why we started on this path and the pain points that we had, and these are pre and post-COVID relevant, and you'll know the intersection of these diverse social challenges that have made this a priority for council and why this work started to begin with. We talked in the needs assessment about the various areas and priorities that were identified and how layered and interconnected these were. And this again came out in the data, it came out in the design labs as well. It's hard to just only work on one thing, you need to look at it holistically. The needs assessment findings, so this is like a 1 page out of 150 page document, and talks about some of the urbanization pressures that obviously are entwined with some of the social challenges as well. Some of the challenges that were particularly highlighted, and you can see it right there, ranged from poverty, housing affordability, to educational attainment, and just health outcomes as well. The drug or the opioid and meth use challenges and demands on public systems because of some of these social issues were highlighted in the data and also in what we heard in community as well. And then, of course, the population lens and some is paying attention to how these issues manifest for different groups very differently. So not wanting to lose sight of the fact that some groups are overrepresented in terms of marginalization. So Indigenous people, newcomers, youth unemployment has always been a key issue, and it's rising again because of COVID and other issues as well. So, sorry about this. We also did an estimate to understand exactly what type of demand we had in the community, and this helps us model longer term what type of capital and support is needed as well. We had a specific mandate to look at those at risk of or experiencing homelessness when we looked at this piece. although you could technically apply it even broader, longer term, if you wanted to have a much more comprehensive community infrastructure or social strategy as well. But here you can see there's about 6,000 people that we estimate experience housing instability, and about 1,800 or so that actually will fall into traditional homelessness. Not everybody's obviously in need of the same level of support, but it gives us an idea of what this annual flow looks like. And then from here, and I know I always get questions about how you do financial modeling, but essentially what you do is you build a system of input flow through rates, and then you start modeling different scenarios based on diverse assumptions. So the types of assumptions that go into this type of a model include everything from the cost of actually serving a person per year, the different levels of acuity and the relationship between acuity and the level of service, which also has a different cost. The type of migration and growth relation segment, so that we understand over time what this might look like and what the flow through might consist of when you look at good performance of the system versus okay performance or poor performance of the system. So in this list of scenarios, you can see there's a number of assumptions around time span, and some of the outputs are outlined in terms of cost per year, total cost of delivering, and the type of targets and spaces and numbers of people served. And we ran them, and again, I'm more than happy to do a tutorial on financial modeling. I know it's not everybody's immediate cup of tea, and it's not normally something we do in the social sciences, but it's definitely something very, very valuable to understand, because this tells us a little bit about, if we were to maximize the type of investments that we currently have, is there still a backlog? And if we wanted to serve everyone that was chronically homeless or exotically homeless, this is what the cost might be, and this is where we might invest some of these resources. So we developed this in a lot of detail with all of you in May and June, and kind of landed on this likely scenario where we are we still need some additional funding for sure. And I think this was again not pre-COVID, but during COVID. So who knows what the long-term implications are going to be. But that would still get us to some of these targets and enable us to maximize what we have, without assuming that what we have is going to meet all of those demands. But it would require a considerable amount of coordination and integration between the supports that are in place, on top of some additional investments as well. I know there's probably lots of questions on this, because I literally have one slide, but I'm happy to answer something right now, or if of use, and I offer this to city staff as well, I'm happy to run just a financial modeling 101, just so that we don't have to put some of you that have seen this in May through the same process. So I'm happy to pause here for a second and see what you guys think.
Anybody feel free to jump in. I can't see any faces.
I'm going to jump in with a question.
Yeah.
I'm sorry, I'll beat you. Regarding the worst case, is that money that has to be spent locally, or total money spent from all sources, federal, provincial?
Yeah, it's all sources. Yeah, it's all sources, of course. Yeah, most of the funding that goes into this type of a system is, I would say, 80% provincial, and normally, or through some provincial ministry, whether it's poverty reduction or housing, or so it does seem to, in different communities, it's a bit different, but more or less, and it's for sure provincially sourced. And even when it is municipally sourced, the municipality is actually a flow through of provincial money, so it's almost like a grant manager role. Feds for sure have a big role to play, but the federal investment relative to the provincial is still small, or on the smaller side. Now that's probably going to change with the CMHC rapid housing investment for COVID. So we might see a kind of a more balance between the feds and the province in this regard. There's always a role for municipalities. It's just, their budgets are not as big as those other levels of government.
And would that include building houses, like all of that wrapped into that money? So why is 2.16 a worst case and the best case is only 4.5? I would think if you're spending more money, that would be a better case.
Well, I see what you mean. What cost per year, it's a lower cost per year, right? So it means that you're maximizing your current system.
Okay. All right.
Yeah. So it's saying like if we were going to let's say take all the money back and start over again and optimize everything, we could get to this, max performance, max output, max outcomes. But that's very unlikely because it's very unlikely that we're going to get that mandate from senior levels of government where we can take over contracts and restructure all of this system. So that's why. But it's a really good question. Yeah. So, and I feel like you had another question, Dawn, and it escaped me. But.
No, that was it. I think Aaron had one or something.
I just saw John come online. John, do you want to say anything? Yeah, go ahead.
Yeah, I just wanted to, maybe this is one of those one-on-one conversations, but how did you factor what were some of the factors that allowed you to differentiate between a worst case scenario and a best case scenario?
Yeah, so in the big assumptions that we played with were around access to current stock was a big one. So this whole, can we actually reorganize how the current investments are performing, or the matching between clients and units. So that was one of the assumptions we played with, to say if we had access to X% of the available funding and we organized it in this new way, what would kind of outcomes would the model suggest we would get, versus if we said we're going to have to just ignore what's there and just work around it and essentially just kind of build on top of, build a scaffold on top of it. That's obviously going to be more costly. So that's one thing. The other thing we played around, and yeah, maybe I don't know if it messes Ledge up if I bring out our May presentation, but I definitely can do that for sure. It might be good to jog everybody's memory from that meeting. But John, the other one that we played with was to see if we were only serving X% of the at-risk population and focused on chronic homelessness, you get a lot better cost savings in the immediate term, because they tend to, they have higher public system costs. So then the kind of net ROI looks better. But of course, as we all know, then you're leaving certain folks behind when you're only dealing with chronically homeless populations. So that was the other bit. So yeah, there you go. This is our May session, and some of the assumptions that we took on. So target turnover, so the amount, the length of stay somebody stays into a particular program, the negative exit rates, which again, this is an assumption of a pretty well-functioning system, that are negative exit rates. So if it's back into homelessness, for instance, would look like this. This is a pretty well functioning system, so we assumed it was kind of state of the art, which may or may not be realistic, but again. And then these are the operation OPEX and CapEx. So to your point, John, about capital versus operations, we played a little bit in the different scenarios. Do you guys remember this? With like the different pie charts. So to say, hey, if we put in more in support a scattered site versus building new buildings, you can obviously get, there's pros to owning buildings and having that in community long term as affordable housing, but then it takes longer and it's costlier, et cetera. So there's in the scenarios we looked at that as well. So I don't know if you guys remember all this. It was back in May. We can totally go back to it though and spend as much time as you like on it. The big message, of course, is that the more coordinated you are and the more kind of consistent your outcomes are to best practice, the better your results and your cost efficiencies are. But it also all hinges on getting money into the system to resolve some of the backlog, because whether it's best case or worst case scenario, there's still money missing from the system, especially around that complex needs population. Hope that answers.
Maria,
Somebody question?
I have one, but John does too.
okay.
Oh, I think he was giving thumbs up, like he was good.
Oh, okay. Thank you. Sorry, John. I just wanted to ask you, Elena, how the social impact assessment shows what our priorities should be for different groups at risk, and what are your recommendations, and how can we better service like Indigenous people? Mm-hmm. And you probably have it in here somewhere, but
yes, I do. So let's go back to the other slide. Okay. So you again, you guys would have possibly seen this, and Marina, I'm not sure you were here, but Emmy was, when we talked about some of the planned commitments and priorities, and she gave some really good feedback to especially the Truth and Reconciliation one, because the Indigenous component came out in the data so clearly, and so a couple of things that came out there. Oops, sorry about this guy. And you can see here some of the recommendations that we had brought to the task force before. The one that Emmy really kind of wanted us to highlight is this piece around the Snuneymuxw First Nations leadership around an Indigenous Cultural and Healing Center for on and off reserve Indigenous people, and then just ensuring that the First Nations leadership was front and center in some of this work was something that she, that's why you see it in some of these recommendations, more kind of front and center. And then we had debated whether we wanted to break this into different recommendations to weave it through, or whether we felt like it was important to keep it a standalone. And I think everybody's thoughts were that it should be a standalone commitment and just have it as something that was front and center to the action plan. Does that help answer that, Marina?
Thanks. So Marina, you're muted if you're, does that satisfy you?
sorry, I always forget to unmute myself. I was just really thinking, it's just to understand how this all works, and I know that Emmy and I are sharing. So Emmy was off for a couple of weeks, but even though she works in the office beside me, I barely get to see her. but just really important. And, you know, all I have to do is walk downtown and I could see the number of Indigenous First Nations homeless people. And so, you know, I'm just asking, so I could see how this all fits into the whole big plan and what that commitment is and how we're meeting the call to action with the Truth and Reconciliation.
Yeah, exactly. Yeah, exactly. That's exactly it. Yeah. I'm hoping this kind of gives you a bit of a sense, and we can definitely take some time and talk through it. The education and awareness piece came out. There was lots of, in the design lab, there was folks that talked about being stigmatized for poverty, but also for their indigeneity as well. The TRC calls to action, even if people didn't say we should do it, it's just what we all should be doing as Canadians. And then there was lots of suggestions around Indigenous-led housing and social support. So by Indigenous, for Indigenous were some of the words that we heard. This cultural healing centers was a place that just advances that approach, that non-mainstream, you know, doesn't have to be all Western for it to be effective. And then some of the pieces around control over funding, as you can see here, and having a place at the table. If you know, we are seeing an overrepresentation of Indigenous people in the communities we're trying to support, then it doesn't make sense for, you know, all white people to make those decisions about funding. And actually, Emmy said it really well. She talked about opportunity, where sometimes we say, well, you know, we need to build capacity, and she said it's actually not about capacity. We need opportunity. How are you supposed to build capacity if you don't have opportunity? So some of the wording here it's changed to reflect that as well.
Yeah, and it's interesting because I know that in our community we're addressing housing issues, but with that we're also addressing the health issues, mental health, and just the whole life being. And we're so interconnected, and you know, we even have the RCMP at that table. So really looking at that, and there's so much complexity. So thank you, and I'll connect with Emmy on this too. Thanks.
Yeah, no, of course. Yeah, and I should also remind everyone that all of this stuff is under caveat until we get all of our validation from community completed, and so I know some of the validation is still going on. So I'm sure these will be tweaked between now and when a final report comes to all of you. But this gave the community something to kind of sink their teeth into, so that they weren't just ideating without any framework. So those validation labs are going to for sure put some additional spin on some of these ones that we initially drafted.
Alina, it's Erin.
Any?
I have a couple of questions. One, so going back to the slide that you were just on, this has been kind of an outstanding piece for me, and I wish I had voiced it earlier, but I'm curious because, and this is probably a question to the group, because we have collective ownership of this project and this document that's being produced, this plan. I can see in the priorities, we've got, 1 to 6 under supporting vulnerable populations, et cetera, but the commitments themselves around ending discrimination and truth and reconciliation, how do we as a group take responsibility for some of those pieces? Like is that a collective agreement? I'm thinking, they're pretty broad, support Indigenous self-determination and all funding decisions. Like, who's going to be responsible for ensuring that we're doing that and that these aren't just words in a report?
Well, I think, I can take a stab at helping begin that conversation, but it does come down to, how we structure the implementation process. So you guys will remember we talked about investment and just like I'm gonna make this bigger. You can see it. So yeah, you remember we talked about how investment and policy needs to be coordinated so that, you know, left and right hands are moving in the same direction. We talked about service provider coordination and the various supports and housing that's needed. And then we talked about how we need that systems planner entity and governance oversight body to support implementing this approach. So that it came down to this conversation. So we envisioned a stewardship group that would include these various entities, and then a systems plan organization that would actually do the heavy lifting in implementation. Now, some of these recommendations are, you know, I wouldn't say easy to do, but they easily fall in somebody's to-do bucket. That doesn't mean that they're going to actually execute them. So by having participation in this stewardship group with high-level champions that are advancing and you know, calling to accountability or calling to leadership various entities, that's one mechanism. The system plan organization being there and building those relationships and that collective impact model, that's another way to build that in. And then there's all these kind of, I want to say, bureaucratic ways, but things like adding certain requirements to RFPs. So your point about funding decisions and Indigenous equity in funding decisions. So what I've seen done is funders, for instance, having requirements or targets of how much of the funding goes to Indigenous-led entities, and that needing to have parity between that funding envelope and the population that's being targeted with that intervention. So there are some of these performance management QA processes that can be implemented to enact what seems to be a big idea. I think with the TRC, the big critique that I've heard that we as those of us that are supposed to be doing, we haven't done the work to do the implementation, and we keep saying, well, but tell me, Indigenous communities, what should I do? And it's there. Like, do the work. That's your job to figure out. You know, so we keep kind of putting it back, and it's on us to figure it out and try it and try these different strategies. It might work, it might not work, but yeah. So sorry, Erin, I'm going on a tangent here. Other people might have some good ideas as well.
On the financial modeling piece, the most likely scenario, the best case scenario, et cetera, presumably, so there are actions within that that's going to allow us to say whether we're meeting our best case scenario targets. And are those going to be linked directly into the actions in the report? So if you say, we're aiming for best case scenario, here's how you get here.
Yeah.
Okay.
Yeah, so they would say, so for instance, a target might be house this many people within year one and maintain housing stability at X% as a target. That's the only way you would actually get to those outputs. And, you know, to be fair, it's going to be a moving target because, like I said, you're probably not going to get all the money that you need, and you might not even have some of the performance measurement systems in place to even know whether you're getting there or not in the first couple of years. But it's something that you build towards. So yeah, the model is something you can play with to say, you know, am I on track or not? Just like in any kind of business exercise where you're building a strategic plan and then you've got some targets and some assumptions, but then you can, you know, something happens in the environment or a new opportunity emerges and you can plug that in and see, well, what will this do, right? Or you have a new inflow that's something unexpected, what does that mean for my target? Well, it's probably not realistic to say we're going to achieve this without it. We got no new money, so we got all this additional pressure. So what that's going to do to my, outputs this year is X, Y, Z. But you need to be able to kind of trace the logic and tell the story. That's what this system plan organization's job would be as part of that, which is very similar to what would happen in private sector as well.
Thanks. Does anyone else have any questions?
Nope.
Okay. I don't even know what slide we were on, Alina. Sorry, we got done rabbit hole there.
That's okay. It's all good. It's all good. Like I said, when you guys have your systems planner organization as well, I think this kind of approach, this is good technical assistance for them as well. So, you want to make sure that they know the ins and outs of this work. Okay, so where were we? Okay, so I talked a little bit about this as well, the need to make sure all these pieces are in place. So these are, how are we going to coordinate the system all together? How are people going to access the various housing and supports opportunities that are in the NIMO? And there's 600 or so programs that are active, ranging from domestic violence, mental health and addictions, housing, etc. So very good reminder that people's needs are different, their issues are layered, and so our system needs to be holistic as well. We talked about different ways of integrating how people experience and access the system, and we landed on wanting to have something comprehensive and holistic versus narrowing people by a presenting issue. So saying, for instance, oh, you've got a housing problem, you need to go to this, this bucket to get access, or you've got domestic violence, you need to go over here. And instead we said, no, we should have an integrated coordinated access model that gives people access to the range of service options that they could benefit from instead of siloing further. So I think that was June that we came to that decision to move into this integrated approach. So the way we defined it is a systematic process, integrated coordinated access, by which those looking for support with social health or other needs are triaged to appropriate resources. And then we defined that further into digital navigation. So of course, I have a vested interest, and this is Help Seekers, and this is how I actually ended up working with you guys. As Help Seeker was the systems mapping platform that was brought in by United Way last year with the coalition, and then that's kind of how we ended up connecting because we were doing the systems mapping here. So digital navigation, whether you have Help Seeker, whatever, however you want to do it, it's important that you have navigation. That's how most people tend to cruise for supports nowadays. We also talked about the need to leverage community locations and that are already where people naturally gather, and that doesn't only include the new navigation center, which is awesome because it was one of the recommendations, but there's also natural locations in communities, community centers, community health, primary care centers, schools, libraries, recreation, and other community association neighborhood spaces that should be sites where people can access supports and navigators. I will remind you what we mean by that. We talked about these integrated service tables, and situation table is an example of that. That's focused on justice-related issues, and we have lots of examples of how these work, and I'll touch on what that means. But there's obviously some cases where the presenting issues are so layered and complex that it merits bringing people together to figure out the best way to move a case forward to good outcomes. And then we also talked about a range of navigators, so people that know how to access and how to support others to navigate a pretty fragmented system as we work to get it more streamlined as well. And we talked about that needing to be something that we train and mobilize actively in the community. It's not going to just naturally occur by itself. If you guys will recall that there are folks that are probably sort of the yous and me's, that the teachers, the social workers, the nurses, et cetera, that should have information about how to access social supports and housing supports in the community. And we need to give a baseline understanding of navigation that's consistent to a whole range of groups in this level 1. Level 2 might be folks that are serving that counselor role, or an outreach worker, or somebody that's much more involved in supporting more complex situations. And then we've got level 3, the uber navigators, folks that are really specialized in working with multiple systems and layered needs at that individual level that need to be pretty highly skilled. So we talked about needing to build that capacity in the community to deliver this in a consistent way, and that it's the same message everywhere somebody goes, so people are not given mixed directions depending on who they talk to. The by names list, and this is something, Lisa, by all means, jump in on this. This was what we borrowed from other communities that are working at integrating their police and health, as well as housing and homeless systems, and the ability to actually connect the dots between all of these. And it doesn't mean that everybody does everything, but it does mean that there's an effort to layer the list and look at where best to have a lead case manager, and what the role of police might be in a situation. Ideally, obviously, the ideal situation is that it's resolved without justice intervention, but obviously sometimes that's not the case. So we talked about this, I believe, in June, July is when we landed on needing to have a table in place to connect the dots on folks that might be on different lists at different times, but we actually need to have a process to connect the dots. And so this is part of... Yeah.
So Fletcher speaking. Question, what do the numbers represent in those columns?
Mm-hmm.
Like, I'm looking at line 22, you've got 212 in there.
Oh yeah, no problem. So on this one, and this is not your guys', so this is from another community, and this is how they decided to run their by names list. So there's not like this is how you need to do it or anything. These are instances. So this is this individual, ED78. Obviously, these are all fake names, but in this situation, it's how many times they use the supervised consumption site that particular month. And then what these guys decided to do is they said their number one priority, this is Lethbridge, was the supervised consumption site. You can see here that was causing the most angst in the community, and they decided this is going to be where they're going to focus their initial, they call it a housing split. And so they, as you can see here, you can have, this is police service, this is supervised consumption, this is Intox shelter, this is their homeless shelter, DOT is their outreach program, like needle street level outreach, jail, EMS, community paramedic, and hospital. And as you can see here, this was filtered to look at the highest SCS, supervised consumption site users. And what's interesting, and why I wanted to show this to you guys, is that here you can see SCS is 195 and DOT is 5, but they don't even show up in the LPS, right? So somebody that's really high in supervised consumption, LPS didn't have any records of them. Police service didn't have any records. So my point here was, if by having an integrated by names list, I keep going back to this integrated word, but if you only look at one column, and you can't assume it's going to solve all your issues, because it's actually not necessarily the same person across the board. So you actually have to kind of layer all this and understand their relationship. And sometimes it's surprising, like if you look here, like this JA62, 7 LPS interactions, but it doesn't even go to SDS, and is at Intox quite a bit. So you know what I'm saying? So it's and Jason says it well when he says it's really, up to us, like it's a judgment call to say we should filter by SDS. That's a judgment call. There's some rationale to say, well, we should filter by vulnerability, for instance. So if somebody's a high user of supervised consumption, that's likely they're exposing themselves to higher risk from overdoses. So we might have a rationale to say, well, let's filter by SDS first, and let's do a blitz focused on that. Other communities, and what I've seen happen, is they say, let's filter the ones that are showing up everywhere.
Yeah.
Right, and they do it that way. But it's a different niche, right? It's layered needs, 100%, but you can't assume it's the same person, right? That's why it's important to look at the data across all of these systems. And what's cool here is that, this, being able to share this is allowable under the current legislation. So there's the situation tables are another example of this. The Reaching Home Coordinated Access is another one. But the innovation is that you're actually putting them together and looking and making decisions as a community. This is just how Lethbridge did their first housing blitz. They rehoused the top SDS supervised consumption users. And they brought down their use by 90%.
I've used this in the youth forum in other communities where we kind of did more wraparound with the school and probation and the addiction prevention centers and stuff like that. And we saw a real drop in the overall demand in all of them when we all got on the same page.
You betcha. Yeah. Exactly. That's exactly what we're hoping to see in Nanaimo too. Yeah. Good. Yeah. Awesome. That's great. And it works for everything. Like it's
I've used it in a variety of different formats, but this is awesome. Thanks.
No problem. There you go. This is. Oh, sorry. Did I cut somebody off?
I was just going to say, Leah, just wanted to put slight caution over like the fact that, all those incidences of somebody visiting the SES, yes, that probably reduced. That doesn't speak to their continued use. It's probably a shift to another location. So maybe they've been housed, but there's that kind of service within that housing. So you would still need sort of a commensurate support somewhere else. So it may have changed people going to that location, and that's great, but there's likely still going to be that service. And I think what Alina was referencing before is that the data will eventually lead us in a direction as we crunch it and we get better data. We'll be able to identify trends and places where we could shift. But at this point in time, it's kind of an arbitrary choice of what group we would focus on. Whether it be SES or the top, whatever service users, or based on disruption. And there would have to be a community choice that we're going to focus on X right now, because there's such great need across the entire continuum that it's pretty impossible right now for like a service agency or even the health authority to choose one group, because how do you measure their need versus another need? So I think it would have to be a choice from the community that we want to focus on this one piece, and we could go after that. But I think the data over time will give us keys to where we need to, advocate for investment in some of that change. So I just wanted to highlight that didn't mean that they stopped using it. meant that they
Yes,
stopped going
yes.
to that site, and they were probably using a similar service for somewhere else.
Okay, so go ahead. Lisa.
Sorry. I was just wanting to follow up with the last comment in that when we're looking collectively at someone's overall circumstances, we don't necessarily want to drop safe consumption. I mean, in some ways, that's a very positive step. We'd like to work towards other things, but I hope I'm echoing, the intent that isn't always where the focus should be is in terms of trying to get people stabilized and then see what we can do from there, as opposed to trying to drop a number. I don't know if that's exactly what was going on, but I think that we need that whole comprehensive look at the individual and then try and get them as stable and healthy as we can, and that may include an uptake in some of the numbers because they're doing something better. I would rather see more safe consumption and less EMS.
Yeah.
But the score is going to be the same.
Mm-hmm.
But we really need to have everyone bringing forward their people, because if we only know one picture of it, then we don't have a full opportunity to try and find a solution. If we don't have everyone sharing the info, we can't tell if we're making a difference, and we can't tell if we're trying to put our limited resources towards the people who are most likely to get the best bang for our buck on it.
Yeah, and in fact, you do see that kind of an initial dip, and then you see folks connecting to primary care, for instance. So their health costs, are not necessarily disappearing, but they're more appropriate.
Alina, can I follow up on something Jason said? And Lisa, I just want to thank you for your comments there. I think you nailed it. Everything I'm seeing about this report is that the better coordinated we can be, the more chances of success we have. So to that point, hearing from you, Jason, the data is going to guide us and where we want to focus, and that's going to be a collective decision. What data are we basing that on? Who holds it? Who contributes to it? Where is that data set?
Well, I think ultimately that's the conversation around governance and who in the community becomes the holder of that, because it's not well coordinated. Through the coalition, obviously, we're taking, I think the other piece to note too is we're not going to go from 0 to 100. It's going to be an iterative process. We'll get people to buy in as best as we can. And then we keep refining it, keep inviting more, keep refining it, and then that information gets shared out to all the different tables that do get created. So it's not something that is an immediate piece. The only part that I can speak to from the coalition side is positioning that there's a call for proposal up for right now. There will be a beginning of somebody in the community will be taking that on to start building those processes based on turnover, based on others in our, in Canada and North America's work, demonstrated work. And I think the intention of the coalition's call there is whatever agency takes it on right now in the absence of our governance model and what we're going to do next, they have to take it on knowing that they're just helping build the foundation, and they will hand that piece over to whatever the next entity is or whatever our progression is in the community, wherever that lands. So before the end of this fiscal year, end of March, we will have movement on putting in foundational pieces towards this, but we have to be aware that it takes time. I mean, Alina could probably talk about how long it took Lethbridge, and they were super motivated and threw some money at it, but how long it actually took them to even get a rudimentary list up before they got to the next pieces. Because right now it's kind of, it's not all connected. We have to connect. And we have to have, right now, everybody's doing it off their side of the desk, or the pile is falling off the desk. To try and keep it forward, we need to have individuals in the community as their primary job to herd all the cats, to get everybody around the table and kind of like information.
Okay, so that data set will be built out on the SCA position.
Yeah, that's step one.
Okay. And then, so I have another question, Alina, if I may. So the people coming into the system on the left of your screen, and then they go through integrated coordinated access. I see that really as a service frontline provider component, right? So how are we making sure that people that touch the system are best served expediently by the right appropriate provider, et cetera, et cetera. So that's the position that's currently out with the RFP. Now the investment and policy coordination, that's more about ecosystem design, correct? And that's going to be supporting that integrated coordinated access, but also doing the policy pieces around it. So integrated coordinated access is primarily more frontline, and the ecosystem design you're seeing is more organizational, structural governance pieces.
Yeah,
Okay.
exactly. So when we think about this systems plan organization, this, body that's going to drive all this forward at that higher level, we see them in this square, but not by themselves, right? There's going to be, BC Housing, Island Health, like the city, et cetera. But they're playing in this bucket. And then you've got the service provider coordination, so the coalition and its iteration is, they're going to have a lot more to coordinate than just ICA. But ICA itself is really a service delivery. It's a benefit. It's a system navigation. It's very frontliney work. Now that position is about, what is the workflow? What is the referral process and procedure? What data needs to be collected and shared how? At this level, you don't care about A, B, C, D person, X, Y, Z. What you care about is like, what's the inflow, what's the outflow, what are the barriers, what policy levers do we need to maneuver, and who's playing well, who's not playing well. That type of strategizing is over here, and obviously there's a connection between these two, but there's still a distinct role.
So do you think,
Great.
and this might be more for Jason, that the RFP that's currently out, someone's going to pick up this work, are we expecting that they will, let's say we have 4 tables they do some sort of triage in the community, will that position be responsible for going to those 4 tables and saying, okay guys, we need to have 1 table? Or we need to have 4 tables with clear mandates for how they communicate to each other?
I think it's more the latter, and it's more capturing the data so that it's provided to those tables so they can make the most effective choices. Because each table is going to be dealing with something different, whether it be BC Housing's process in their buildings. What we want to be doing is working for that same list. And if they have 5 vacancies, we're providing them the top 15 possible names, and then they choose that through their process. And then there's another one for another service, but we're working off the same list. And sort of backing up what Alina was just talking about inflow, what's happening in the middle, and then outflow. I actually read a good blog the other day that is the way he was speaking about it is, if you think of it as a bathtub, the inflow, that's the tap.
Mm-hmm.
You've got the bathtub, which is the system, but you also need water going out. So if there's a clog down there, the system in the middle can only hold so much. So you're going to have to turn off that tap, but you have to have an effective mechanism that you can have enough water coming in, holding enough, but enough has to go out so that there's movement. And if you don't, and that's where the policy pieces are, is we have to get what is right sized for our community and also make sure the outflow is unclogged so that we can handle the most efficient amount. And some of the worries often when we're focusing on coordinated access, we can build lists to nowhere. We can capture those pieces, but we have to have, the resources, and right now, there's spillage. And there isn't enough outflow. So we have to change that as well.
Okay.
Mm-hmm.
Yeah, so I get all of that, and I appreciate that, and I want to know how to fix the outflow piece, because that really is where I see the city traditionally, like how are we building housing, how are we advocating for support housing, et cetera. So just acknowledging that seems to be a tension point for us. If we don't know how many people are going into the system and how they're faring in that, air quote system and leaving the system because they've been well supported, then we're building lists to just have lists.
But I
Not
think,
putting lists.
but I think that is the importance of looking at it like this and how it is all connected. Because we can only make decisions based on what we have right now. And I think what we're proposing is better methods of having our finger on the pulse of what is actually needed, matching the demand, it's basically economics is supply and demand. So we're hopefully going to have a more coordinated way of telling the narrative and the meat of our story, so that we can take that to the Ottawa and advocate for the right things, not just the things.
Yeah, and start like with 5, like, I think we started with 5 in Northbridge, it doesn't, you don't have to solve all of the issues, you just gotta get going on something. Cool. All right. So, where were we?
Alina, I'm sorry, I did have one follow-up
Sorry.
question. So
Yep.
the integrated coordinated access, we obviously know that our plan and our work hinges upon not, that this goes well. So we understand what the problem is, we get people into the system, we triage accordingly. So do we see that RFP, that you've identified core ICA components as digital navigation, locations, integrated tables, and system navigators? Will the person that collectively, or the homeless coalition is saying, we want to put someone on this to give someone their job, are all of those components going to be part of what they do?
Should be.
For me, that just reaffirms
Hey guys,
that-
I've had my hand up for a while,
Oh,
but
Signe, I'm
I
so
guess-
sorry, we can't see you. Go ahead.
sorry, Signe. I just wanted to echo what I've heard Jason hearing as well is, I think for this group to spend a lot of time focusing on the coordinated access piece, I mean, I think it's important to do the education and all of that piece, but the coalition and the CAB and us at CE, we've got the funding, we've got to drive coordinated access as a requirement the community has with the federal government. So I think just to echo, if we don't go after securing housing and options for where we can actually house people, the coordinated access piece it's a moot thing. Like, and I've seen this in other communities, and I know I spoke to it at the city council and certainly to the media around our PIT count. The difference between our community and many other communities is 60% of our homeless are not in any kind of, they're not in shelters. They're living on the streets. And so, if we had the opposite, like Victoria, where 80% of the people are in shelters or someplace, really focusing and worrying about the coordinated access piece is truly, that's a priority because you've got a lot of people and places for people to be housed. So you want to get it right. But in our case, we have very few places for people to be housed, very few shelter beds. And so really what we're doing is, put a call for proposal to start testing the coordinated access piece. So really the focus of this group should be about, what are we doing to get housing and options so that we have places that move people into and refine that coordinated access over the next year and a half, which is what other communities have done. So I'm not saying anything people haven't heard me say before, but I think it's like we could spend a lot of time worrying about the coordinated access. That'll come. And this short-term contract is really just to get going. And, whatever comes, whatever recommendations we make out of the Health and Housing Task Force, we can align the coordinated access piece in the next contract starting April 1st. So I guess I'm just saying there is a coalition and a CE worrying about those pieces, but where their conversation about, the dire need for additional housing.
Thanks, Signe.
But I thought you got all this money, Signe, from the specs. You got that all figured out, don't you?
Yeah, we've got money, and I guess the question is, what are we doing? What's the strategy?
Well, I mean, I could I could feel your boots on what to do with it for, yeah, I think you can't really go wrong is what I'm seeing in the NIMO. You need ICM, you need ACT, you need rent subsidies for some of this rapid rehousing work. So, but you're going to burn through it pretty quick and still have a backlog. So I think you're bang on that. ICA is nothing if there isn't the diverse housing options and some of these other pieces coming together as well. So.
Well, and the new funding is just for between now and March 31st, right?
Yeah.
We haven't got a contract yet, but we know there's others on the call, I think, today from the feds as well. So, maybe not. And so, yeah, we will have COVID reaching home funds to invest and in short order, but it's just for services and solutions between now and March 31st. So that's a short-term piece, although it's good. And
yeah. Now the other thing that's going to be happening is that magical $55 billion CMHC investment, and Nanaimo's having such a strong voice to get your piece of that $55 billion is going to be really important as well. So this mobilization, this leadership, the Council of Champions, or however we're going to position this, having the ability to take advantage of those opportunities and leveraging your business community as part of that expansion is going to be really important as well. So you've got opportunities on the table, but sometimes it's actually putting the deal together that seems to be a barrier for communities that let some of these go by, and another community will receive the funding that you might not. What I've seen though is like you guys have gotten together to get some of the funding in from the feds for sure, but the navigation center is another win for you and some of the units. The new supportive housing units are also signs that is starting to happen more. So that's encouraging, but we'll need it times 10. Okay, so conscious of time, I know we talked about the directions last time. I'm happy to go through them again too, but I know you guys have seen them most recently, and I feel like the big things to consider are the governance components, because we have homework we need to assign, and we want to make sure that you all know what that homework is. So, Lisa, did I miss anything, or am I okay to move to this bit about governance and our homework, or?
You're getting a big thumbs up. You're good.
Okay, good. I'm gonna plug in here, make sure I don't lose you guys.
Alina, while you're plugging in, it's Erin, and I just want to respond around the coordinated access. Because I feel like we have a lot of opportunities, especially when we're not in the same room, to kind of mishear each other. And my questions about coordinated access are not to say that there's worry or concern. It's just, if we're having a governance discussion, I really wanted to be clear about what it is that role is going to do and what we're hoping it's going to do in the future. So if the city, that's why I clarified integrated coordinated access is really within the community. And if and when we do that well, that's going to make our system work overall much better. I don't want to give the impression that there's a management of integrated coordinated access or a move to do that. It's just my clarification as we're going through this, that's a community piece, and that community piece is integral to the success of this whole plan. So just want to be really clear about that.
Thanks, Erin.
Yeah, definitely. So again, the refresher here is we talked a couple of times about this, but for those of you that weren't here before, we said that the mandate of the task force will be completed once we kind of provide council with the action plan, and our mandate will be complete. But somebody is still going to need to steer the ship at that strategic governance level. So we're recommending that it probably won't be this group, but it might be a future iteration of this group that's going to support the implementation of this action plan. So back to your point, Aaron, about how are we going to make sure that we're holding ourselves accountable to this? So we put together some thoughts based on other communities and the types of membership that tends to be there. It's pretty high level players. They're usually like from the business community and the Indigenous community. Obviously, people with lived experience we'd want to be having some of that representation there as appropriate as well. Service provider input, and I think you have a clear link through the coalition as well. And then making that distinction from the system plan organization who's really running the coordination and development of this new way of doing work, and not, again, distinct from service provision at that community level. Good reminder, Erin, because the system planner is really exactly what the name is, system planning. So the systems plan organization has a key role to play when it comes to innovation, capacity building, convening these diverse voices and stakeholders, making sure that everybody's moving in the same direction, uses a collective impact model. If you've ever heard of that before, backbone organization is what's used in those conversations. But what's a bit different than a backbone organization is that the systems planner is really active in developing the ecosystem as well. So they're not just convening to talk, they're actually driving some of these actions forward. They're coordinating funding as well in some cases and bringing people together to make these deals happen in real life. So that's the kind of next step in the implementation of the plan. And we wanted to, of course, put some recommendations forward as well. So the revamp of the task force as the stewardship group and having that implementation oversight. We talked about it still having a formal link to council, but not to exist at the sole discretion of council. Talked about collective impact and implementation rules, transparency back to the community as well. So having a mechanism to report back will be important to ensure everybody's up to speed. And we hear this already, that people, are putting recommendations into our design lab process, but they're saying, well, how am I going to hear back? What's happening with my input? How do I know we're making progress? So there's a role to play there for this group as well. And then we talked about needing to select a lead systems plan organization to support this coordination. We talked about it being locally embedded and Nanaimo focused, having those relationships in community to be able to maneuver some of these actions, but still being, have the chops to also have conversations provincially and federally to make sure that what Nanaimo needs is top of mind for decision makers as well. We also talked about the cost sharing of something like this. It's for the entire community. It's not just benefiting one party. So there's lots of examples where the costs of something like this are shared among key partners as well. So it's not just on one person or one organization's tab. And then I gave you some examples, or at least the working group, we talked some examples. So Kelowna, and I pulled this one out just because you had some exposure to Kelowna recently, and they went forward with a standalone arm's length entity. They went through a process similar to what you are all going through to say, do we have somebody in the community that's able and willing and resourced or resourceable to do this? And their decision was that they did not. And so they wanted to create something neutral that was had just a sole responsibility for the strategy implementation. A little bit about how they ramped up as well. So obviously they're still very much in this early phase of they're still in the startup phase. They are a 2-year-old entity right now. I cautioned you before about the standalone needing a longer ramp up time sometimes because you need to you sometimes get caught up in all these initial activities and you don't get to the work, which is why things like the RFP for the ICA position are already out, so that we're not holding up the service level work because of some of these policy coordination bits. They're all really important, but you know, that it doesn't have to be so linear. We can do some things at the same time, so we're not wasting time and waiting for approvals and paperwork. So a little bit about how they are approaching this and when or how they're sequencing their approach. They are particularly focused on homelessness, and I know that's a primary driver for you, but you have much bigger ambitions than just, I don't want to say just homelessness because that's a big chunk of work, but you definitely have the ability through your approach to do a lot more than that as well.
Can I ask a question?
Sure.
Can you go back now 3 slides? That one. Yes. How does this entity, this group, this organization make sure that key partners are doing their part?
That's a really good question. So I was the VP of a systems plan organization in Calgary for 7 years, and that was our number one problem, is that we, as the arm's length entity, had this job of coordinating and helping get people on board. So there was a lot of cajoling, there was a lot of coordination, there was, in some cases, we had funding relationships, so it's a lot easier to, tell somebody what to do when you're holding the contract. But it's a real challenge when it comes to coordinating with, let's say, city council, for instance, or ex-ministry, because you're really you're not in a position of power in those cases. So what you actually have to do is have a pretty solid lobby strategy with decision makers, build their relationships, but then also, have an advocacy approach in place as well to get that going. The way we did it, and there's obviously not one way to do it, is that we would lobby to ask the statutory entities to formally support the action plan on homelessness, and then we make specific recommendations. And what this means for you as the Ministry of Seniors and Housing is that Calgary should get this much money to implement. Of course, we never got all of it, but we did get a lot. So in Alberta, we went from $0 in Housing First to, I think we're at like $90 million per year now across 7 cities. So it's doable, but it was a very deliberate lobby effort with political and administration key stakeholders. So I don't know if that helps.
Well, the Alberta model is they have a bit more money because the money is given to the cities for these issues, whereas we don't.
I love that. Yeah, it wasn't the case 10 years ago. It is now because of this lobbying that happened. Initially, the money didn't even exist. There was no investment in homelessness. I think it was, maybe $500,000. Then it went to $5 million under Klein, and then it just blew up from there. But and now Alberta's really broke, so we'll see what happens.
So I'm just wondering, like what sort of carrots would this organization be able to have over? I mean, I'm going to assume everybody's going to sign an MOU saying what they're going to do, what their plans are, what their expectations are of the other members. But other than that, there isn't really much to say. If someone just doesn't want to play, they just don't play.
Yep. I mean, you can do the public shaming. Ottawa does that, where they do a report card to say, here's the community's action plan on homelessness, and here's what the city did, here's what the province did, and then they kind of do that strategy. That's not always the best, but it's also I don't know, it's good advocacy at the end of the day and making these cost efficiency arguments, being able to demonstrate value to those decision makers. I don't think any entity can make anybody do much, especially when you're talking to the provincial and federal government. I don't know, you probably know a lot more as a city councillor than I do on this stuff.
Well, I'm just hoping that, that the organization is more powerful as a group than it is as individuals. And that's what holds everybody together, like a great big chunk of coral.
Yeah.
It's more powerful and has more sway as a larger entity than individuals.
That's the hope. But yeah. Sorry,
Jason had some.
Yeah.
I agree with that, Don. That's one big part. And would you not say, Alina, that if a lot of the investment to our community is flowing through an entity like that, and you have to be part of that collective to access that money, would that not be a large carrot for those entities? You know, if it's being driven to our community in that manner, that's how, as an organization, you get access to pieces that we're coming into the community for that plan.
So
it's a good idea. I've seen that work. It requires lobbying to make that requirement come with the money, but yeah, it can definitely work and kind of force alignment.
okay, just throwing an idea out there, so our $900,000 Reaching Home funds that come through and are distributed through the Homeless Coalition and kind of shepherded by the United Way, is there a scenario where those funds go to this outside entity and then people who want to play the game sign on to an MOU saying, yes, I'm going to share what I can share, and we're going to have common tables of triage, and is that the term matching?
I mean, that would ultimately be it, because everybody has to.
Because there is no carrot with those Reaching Home funds, right? Well, not
The Reaching Home funds are actually minimal compared to what we need in the community, but they are a piece of what goes there.
But they're what comes in right now. So
Yes,
we need
but-
to give that entity some power in.
Yeah, I would agree that that's where those funds should go, if that's the community is coalescing around something like this. I do absolutely believe they should be in concert with everything else. But I think this has been the issue for a lot of years, is people make this assumption that we're getting tons and tons and tons of money through this, through the federal government. We get very little when it comes to actual programs through that source. And we need the biggest problem that I've seen for years is that it is that sort of assumption, but it's not bearing out in reality, and we haven't been going to find other ways to bring funding to the community. Which is, if you look at it, there isn't much there. You know, there's less than what my agency gets from all of our funding sources. Like, we get 3 times as much for services that what the federal government gives directly to the city for this piece. And we're just one small organization on this thing.
Thank you.
So you can imagine if this thing works, you could have, like, let's just imagine that there was a funding coordination capability here, and you know your BC housing investments, and then I know your CMHC investments, and then I know your BHAS, your Reaching Home. That all together is, you know, we're talking about actually millions and millions of dollars. I can't remember the exact figures from the social impact audit, but we mapped that out, and it's definitely not just Reaching Home. So I really, you know, would say that's a very, you know, we don't want to hang our hat on that, because it's important money, but it's not the only money. But imagine all of these were coordinated, and your philanthropic investments were coordinated, and these funders were able to invest as like a dragon's den of social impact. That would be so much more powerful than each one of them sort of doing things on their own and not necessarily aligning that to this vision. That would be so powerful to do, and so much more effective from a coordination and ROI perspective. Agencies would appreciate not having 500 forms to fill out. So we always get questions about how much does it cost to run something like this, and again, I'll tell you like the cost of an arm's length and say it's always cheaper to piggyback off of an existing entity, of course, depending on what kind of resources they would be able to contribute. So for instance, things like back office, HR, admin, secretary, office space, if you're kind of latching onto something that exists, it's going to be less cost, but a community that's, bigger in size, but smaller in scope, you can see there that they're looking at about almost $1 million when fully ramped up. And again, they've got some city contributions that I know some folks wanted to know, like what's the city's kick in some of these cases. Sometimes it's bigger, sometimes it's smaller, but this one was funded primarily from a philanthropic investment from the Kelowna community, but it can come in all shapes and sizes. It's a relatively small amount when it's spread out amongst different entities, but I do realize it's hard to justify money that goes away from frontline services. And when you're talking about coordination, it's sometimes a tough pill to swallow when folks are needing that support on the street. So something to consider as well.
And can I just ask a question? Can you shorten that timeline by throwing more money at it?
Yes. For these guys, this is how they wanted to move along it. But yeah, I mean, of course, I'm scaling our shop here, and the more people you have, the faster you can go. So yeah, of course, and then there's certain things that come with scaling quickly though, which is sometimes your processes are you're not necessarily like doubling up by doubling the money, because you still got to do some of that ramp up stuff. But yes, in theory, yes. Yeah. And then I just put on the other side how they transition, because I think that'll be something to consider for you guys as well. And the committee said our mandate to council is finished. Now we need to actually move to this new entity. So they established a very small, I think it was like a 6-person working group, so similar to what we currently have, that worked on getting the terms of reference for the new stewardship together, the funding arrangements, and found somewhere to host the space, and made some of the hires, the CEO hire, etc. And kind of got some of this ramp up going in the first 6 months before this new entity kind of got up and on its own. So just a couple things to think about there as well. And what else do we have? Oops, yeah, your turn. Yeah, and then here's the homework piece that we're hoping to have for making a decision on which way we're gonna land on this. And it's something that we're having to ask these entities. Oops, sorry guys, something like that. So all these entities have to do some thinking about whether, again, is this something that they fit in their current roles? Can they do it? Do they want to do it? Do they have capacity to do it? They might not have capacity, and so they might need additional capacity, and that's obviously a consideration. And we listed some of the key responsibilities here, and just as a guiding framework for the various entities to think about. So we've got the coalition. These are do we expand the role of an existing entity, or do we have a new arm's length entity? So the coalition, the United Way, the City of Nanaimo, BC Housing, Island Health are some of our existing entities that could potentially do this. I'm sure not all of them are keen and putting up their hands, so it might be a moot point with some of them. But again, this is what we identified. And then we talked about this arm's length social development entity that could take this on. And then last time there was the motion of this merged Economic and Social Development Agency, and we talked about that at length last time. I did a presentation to the Economic Development Task Force, if that's the correct name of it, just to get them briefed on the conversation, and there seems to be definitely some interest in exploring that as a next step. So between now and when we give you guys this action plan, we would like to have one of these named as the entity that's going to run with this moving forward. And that's kind of it, because now it's all over to you guys. Because it's about how do we arrive at that decision between in our next couple of weeks here.
I'm going to start off with a question to Jason and John. Where do you see your two organizations in this? Because you're not on the list. And I know you guys are doing a good chunk of the work. So, how do you see yourself fitting in this part of it?
It's a very big question.
Mm-hmm.
When to start?
You could be.
Discussions about this, we try and figure out, we have, like every other organization, we're not actually that, we're not a large organization, and we have service contracts that we are signed on to deliver, and at the same time, we recognize that we are part of a large network of agencies that spans across the country. We do have resources that are similar to maybe United Way and Salvation Army that we can deploy to a certain extent using some of the resources that we have. And I mean, some of the reasons that we have Alina here is partly because of Jason's network of agencies across the country. I think that, we're, well, certainly from my perspective, we're open to any ways that we can assist in this process. I don't feel like we have sort of any kind of empire building, wants or wishes here. From our perspective, we're just trying to help it as best we can with our limited existing resources. I don't know how to really answer that question, Don, but I think we're open to having conversations, as I'm sure Jason is. He'll obviously isn't shy to speak up on these things. So from our perspective anyway, the John Howard Society, we're happy to participate in any way that we can, and we're happy to consider how we can help out. I guess is the best way to address it.
I would echo what John's saying. I think from our perspective, we are just in absence of a coordinating agency, whatever its form, we're just trying to do our piece where we can. And we can only do so much because, same as John, the majority of what we do is operating contracts. But we do view it as we're at an important point right now. We have some really new opportunities in front of us. And it's a good thing that we are, because the need out there has grown so much. And I think we're just here for the moment to do our piece until we decide what is next in our community. So most of my time and energy that I give outside of our agency is to the coalition. And although we're not named there, we're members of the coalition. I am one of the co-chairs, and these are conversations that we have with other agencies. So I think that's where it is at the moment.
I would also say that, as sort of holders of contracts, and part of that, the sort of collective calculation that Alina has put together about where the funds are going to support the work that's going on here. I quite genuinely am quite open to, how we can work collectively to try and make the best use of those dollars that come into the community. And I really, see our different organizations as kind of sandboxes that we can, use to do the work that we're doing. But there's a lot of alignment in the Nanaimo Homelessness Coalition around what we're trying to get done, with a great deal of the work that's been done thanks to the efforts of Jason and everyone really around the table. But Jason's really played a really important coordinating role in that regard. So that's really been great. And I think also Stickney has done a huge amount of work to try and move that along with it. And it's helped us all to kind of learn how to work together and think collectively towards the end goal. So I think this is an important time for all of us. And I think that we do have kind of the alignment of interests around how we can try and address these issues. So I think it's a really good time, Dawn, for us to be thinking about this. And I think all of us around this table, at least, are really, well, certainly from the community agency's perspective, we've put aside any kinds of, competitive streak we might have, or, around, who can do what. We're just looking at what we have and trying to figure out how we can address the needs that are before us. Because really, I think we're at a point where we're going to be overwhelmed if we don't address them as a community. And so it is imperative upon all of us that we respond in a really magnanimous way towards addressing these things. It's just taking whatever we have as resources in each of our organizations and throwing them on the table. I'm reminded of kind of the movie Apollo 13, when they had to try and figure out how to scrub the air in the capsule, and they just threw a bunch of things out on the table that they knew was in the spacecraft to try and figure out how to address it. And that's similar to where we are right now. What have we got that we can use? How do we address this? What do we need to try and bring into the community? It's kind of an all hands on deck kind of a situation from my perspective.
Thanks, John. I see Sydney has her hand up. Sydney, do you still want to speak? So, Lena, what would be most useful for, we have 15 minutes left. What do we need to leave this room with?
Well, it's the conversations that need to happen and who needs to be part of them to make this, to essentially fill out this chart. So, Lisa and Karen chime in on this as well. At the working group, we brainstormed a little bit about some other folks that we wanted to reach out to, and it might be, since they're kind of associated with entities already, it might be inviting them to the design lab where we talk about the recommendation. But anyway, we needed to get your guys' feedback as well, because we haven't really fleshed out who else needed to be part of that, outside obviously of the named entities and all of you guys that have been part of it all along. So Lisa or Karen, did you want to chime in on this to pick up on last week's working group session?
Sure, and I actually might call on Tara, who was the one who responded by email with suggestions of who else should be included in the conversation. But I think it would be really good if the task force had some ideas about who isn't part of the task force, but is key to the governance and the funding pieces. So, for example, there's MCFD is one example. There's other Indigenous funding organizations, FMHA. So I'll pause there and see. And Alina, maybe to be clear, because maybe you haven't thought about this in any depth, throw names out, but email us afterwards as well.
So my understanding is that we were today hoping to invite those people to participate in this, but that didn't get off the ground, Thanksgiving, et cetera, et cetera. So today we just had a working group meeting, we went through it ourselves. Our next task is to fill out that list that came from Karen after the last meeting, because we brainstormed who we want in the room. So then I'm looking at Lisa, those of you who can't see me, do we want folks to add to that list, put names to that list, and the city will be responsible for inviting them to the next meeting?
That's right. So
Okay.
this was done last Wednesday, and we didn't get the full contact, so to invite them on the Friday of Thanksgiving didn't look like it would work for today. So we'll circulate that list again and add in, Tara, your responses, and see if we can flesh out who are the right people for to be in the room. And then, Alina, I think the other thing that we mentioned was that some of the task force members may have colleagues or senior management who this would be the time to bring them forward to the table because they have influence on whether it's a treasury board request, if it's provincial, they're the chair of the board, those types of decision maker influences. Alina, does that sound like it captures?
Yeah, definitely. Yeah, I think we were just, kind of behind the 8 ball with, timing for those guys to make it today. So, so since we kind of got ourselves some more time, if there's any additional folks that need to be brought in, I don't know, Karen, if you have the list handy, but we can throw it up as well so that everybody knows. Sorry about the dogs. It's supper time here, so everybody's excited.
We're just checking on that, Alina. Do
Yeah,
you have the list?
You do have the list, I'm just asking, Lisa, because originally this meeting with inviting other folks was going to be this background piece. Now, the next session is technically scheduled to be the active conversation about governance. One conversation we had after we discussed that was whether it's better to have one-on-one briefings with people, pretty important people who may not want to be briefed to a larger Zoom format, and then bring them to the table for the actual decision-making portion, as opposed to having another meeting next time that's more background here.
So then, would we invite that next meeting for that conversation and decision? That would be in 2 weeks' time, and we would prep people before then?
That could be an option. I'm just wondering, like, in terms of getting busy people to a meeting, rather than having, asking them to do 2 meetings, one of those, which is basically a repeat of today, right, for everything. Other saying, if you start having a decision-making forum, which may or may not be camera, that's to be decided.
Yeah.
But having conversations, say, here's some background material, or brief description of projects, 2 hours of briefing.
So Alina, one suggestion would be to have the synopsis of the project in one of your PowerPoints, the key pieces, and then the task force members maybe divvy up the task of reaching out to different people, giving them a snapshot of where we're at, and then a clear understanding of what we're looking for from them. And if they're not the right person, that they refer us to the right person.
Yeah, and I mean, if presumably those of us that have been here the whole time should be able to do that for their respective groups. So Coalition, Jason and John, Signe is clearly, she knows what's going on. City, so, it's really the groups that haven't been engaged that we have a problem with. So I really don't want to put you guys through another iteration of this. Like, I feel like we've been through it ourselves. So I think it might be a better use of time. I would lean towards that second option of reaching out to the folks that are kind of assigning kind of key people that are going to run this up the flagpole. So as task force members, for instance, Lisa from VHA would, pitch this internally and do that homework for Island Health. And then if there's folks outstanding, then we can kind of divvy them up between whoever has the best connection with them, if they haven't been part of the process.
Okay, I just want to make sure the staff is going to be tasked with that. So we understand what's happening. We're going to have decision-making meeting in 2 weeks' time. We're going to flush out that list of who needs to be invited.
Yes.
Okay.
And Alina, given the time for this contact, we may be asking task force members if you recommend something, or if it's somebody senior in your organization, that Alina will give you the slide deck, and we will hope that you will do the outreach to encourage them to participate.
Yeah.
And Alina, from my own sense of process, after we leave that meeting with a whole bunch of stakeholders who have input into this and we have a conversation about governance, then you go away and process what you heard and bring something back to us based on that. Okay.
Yeah. Probably first to the working group and then rinse it through the working group and then to the task force. Yeah.
Great.
Like, hopefully it's really like clear cut, but you never know.
Okay, could I also ask, Alina, you had noted that your you had offered to do financial modeling follow-up with anyone, so I wonder if that email to the group, if we could just put that, if people would like more in-depth, information on the financial modeling, then.
Yeah,
If
love
a
to.
group of people
Yeah.
can coordinate that, so you're not doing it multiple times.
Yeah, definitely. Happy to do that.
And I mean, can I just ask with respect, we just have to check with Ledge to make sure what the rules are around quorum, something like that, or how that would work.
That would be separate.
That would be, okay.
Great. We have 5 minutes left. Alina, anything from you?
No, thank you. It was kind of like cool to see all the stuff we did. So,
It was.
kind of like a trip down memory lane for last year. I'm like, let's get going. Decision time.
Okay. any
I have
questions?
something.
Go ahead, Don.
In the last little bit of interviews I did for the people who have lived the experience, I interviewed someone who's been homeless in Nanaimo since 2010. And all he wants, he's now a senior and he's looking for seniors housing.
Thanks.
So he was already an older person when he first became homeless, hey?
Yeah.
Yeah. So this is something to look out for. I'm in Abbotsford. I just saw the same thing in their PIT count. First time homeless seniors. Like, we don't see that for seniors to be a senior your whole life and then become homeless. That's not a thing. That wasn't a thing. That's something new.
Yep.
Okay, thanks for that poignant reminder, Dawn, of why we're doing this work. Anyone with final comments before I call for a motion to adjourn? Okay, I want to note the mayor's been in the room for the last 2 hours. I didn't announce him, but he's been listening.
It's quite all right.
His listening ears on.
It's not that important.
Oh, wow.
Very important. Okay, then I would ask for a motion to adjourn. Jason,
So moved.
seconded by Dawn.
Second.
Okay, thank you all very much for your time and efforts today. Really appreciate it.
Thanks, everybody.
Take care.
Thanks.
See you, everyone.
Bye.
And just to be clear, when I said it's not that important, I meant my presence, not the work of the committee.
Oh, we do.